The clinical manifestations of a hydrocele typically involve a painless inflammation or swelling of the affected testicle, or both testicles in the case that the hydrocele is bilateral. On some occasions, this inflammation can lead to pain and redness in the affected area. However, these symptoms are generally mild and do not prevent the performance of daily routines. The diagnosis of hydrocele should be made by a urologist who will perform the following tests. Palpation. The circulating fluid makes the testicle very soft and unnoticeable to the touch. Upon more carefully palpating the scrotal sac, the specialist will perceive the swelling, but note that the testicle is of normal size within the scrotum. Transillumination of the scrotum. It is a diagnostic test that involves applying a light source behind the scrotal sac in order to illuminate it and identify a hydrocele. When there is a testicular hydrocele, the scrotum lights up because it is filled with transparent fluid. Ultrasound. It is used to confirm the diagnosis of hydrocele and also to check that there is no testicular tumor. In addition to these tests, the specialist may also recommend performing a blood test and a urine test to check thoroughly for any infection that could be the possible cause of the hydrocele.